Good morning. Today we talk about the oral mucous membrane. The oral mucosa is a barrier that separates the underlying tissue from their environment. It consists of two layers: the surface layer, which is stratified squamous epithelium, and the deeper layer, which is connective tissue called lamina propria. The oral cavity has described as the mirror that reflects the health of the individual. Changes indicated of disease are seen as alternation in the oral mucosa lining the mouth, which can reveal systemic conditions such as diabetes or vitamin deficiency. Or function of oral mucosa. The oral mucosa have different function as protection, which is called cause barrier for the mechanical trauma and microbiological insults, and sensation, temperature, heat and cold, touch, pain, taste, bud, thirst, reflex such as swallowing, itching, gagging, and salivating. Also secretion by salivary secretion, and then thermal regulation, which is important in dogs, not in human. Classification of oral mucosa, either based on the function or based on keratinization of the oral epithelium. Based on function, classified into three types: masticatory mucosa, which constitute about 25% of oral mucosa, which are present in the gingiva and hard palate. Second, lining mucosa, which covers about 60% of total oral mucosa, like in the buccal mucosa, lip, oral cavity, oral floor of the mouth, floor of the tongue, and alveolar mucosa and soft palate. And third is a specialized mucosa, which constitute about 15%, which is present on the dorsal surface of the tongue. It's called specialized because it contains taste bud. And second classification upon the types of epithelium, either keratinized or non-keratinized. Keratinized include orthokeratinized and parakeratinized. Structure of oral mucosa. As we said, the oral mucosa is composed of surface layer, which is oral epithelium. This is the oral epithelium. And the second layer is the connective tissue, which is called lamina propria. This is the lamina propria, reticular, and this is papillary part, and this is the reticular part of lamina propria and submucosa. So the oral mucous membrane composed of epithelium and lamina propria and submucosa. The epithelium derived from ectoderm and it stratified squamous epithelium, resemble in the skin, resemble the epidermis. And lamina propria, which derived from the connective tissue in skin, it equivalent to the dermis. Lamina propria is thin, vascular layer of connective tissue below the epithelium of an oral mucosa, and in between them there is a basal lamina or basement membrane. And third part, which is also connective tissue, is called submucosa. Below the lamina propria may be present, so the oral mucosa is called movable oral mucosa, or may be absent, so the oral mucosa is immovable or firmly attached to the underlying structure, like in the attached gingiva. This is the epithelium. The epithelium of oral mucosa, as we said, is stratified squamous in type. It may be keratinized or non-keratinized. When it is keratinized, layer may be orthokeratinized and parakeratinized, depend on the presence or absence of the nucleus in the corneum layer. The keratinized oral mucous membrane This includes 4 cell types. The first cell type near the lamina propria is called stratum basale or basal cell layer, and the second layer is called a Brickell cell layer or Stratum Spinosum, and the third layer is called the Stratum granulosum or granular cell layer, and the surface layer is the Stratum corneum or keratinized layer. The oral epithelium is keratinized or parakeratinized or non-keratinized stratified squamous epithelium. The interface between the epithelium and connective tissue is composed of structureless layer called basement membrane or basal lamina in electron microscope. This interface is irregular and is composed of a downward projection of the epithelium. This is the downward projection of the epithelium, which is called retipex, and the upward projection of the connective tissue from the lamina propria. This is called papillary projection. The basement membrane is the interface between the lamina propria and the basal cell layer of the epithelium. In light microscope appear thick, and it includes the reticular fiber. It is a zone about 1 to 4 micron in depth and is relatively cell-free zone. This zone contains mucopolysaccharide. Under the electron microscope, the basement membrane is called basal lamina. But it is not just a membrane, it is a basal complex consisting of lamina and fibers. The basal cell of the oral epithelium attached to the basal lamina by hemidesmosome. This is the cell of the basal lamina, and this is the hemidesmosome, and this is the lamina propria, and this is the anchoring fiber of lamina propria, which adjacent to this is the basal lamina, and this is the hemidesmosome, which attach the basal cell layer with the anchoring fibers in the lamina propria. So this is the lamina lucida adjacent to the epithelium and lamina densa adjacent to the lamina propria. This is under the electron microscope. This is the junction, and this is the lamina lucida and lamina densa. The characteristic features of the oral epithelium present in the oral mucosa. First, the epithelium is composed of cells tightly linked to each other by desmosome and arranged in strata, mean layers of cells. These cells are called keratinocytes, and it's composed about 90% of the epithelium cells. The name of these cells, keratinocyte, not due to its ability to produce keratin, but to its content of tonofilament, which is fibrous protein. And these keratinocytes are present on all types of oral epithelium, keratinized, parakeratinized, and non-keratinized. The other 10% of cells present in the oral epithelium are non-keratinocytes, which include melanocytes, Langerhans, Merkel cells, and lymphocyte cells. The deeper layer, or basal and suprabasal cell layer, have the ability of active mitotic division, and these cells replace the continuously degenerated surface cell and the process called renewal or We talk about the types of oral epithelium. We have 3 types, which all of them stratified squamous epithelium, either keratinized or orthokeratinized, parakeratinized, and non-keratinized. All 3 types share many similarities, especially in the deeper layer, basal and Brickell cell layer, and differ in the superficial layer, which is a granular and a keratinized layer. The first layer in the oral epithelium in keratinized oral epithelium or orthokeratinized is stratum basale or basal cell layer. This is the basal cell layer, which adjacent to the lamina propria, and between them we talk about the basal lamina or basement membrane. This is the basal cell layer, which is single cell layer, cuboidal or locolaminar in cell, single cell layer. Between them is the desmosomal junction. These cells synthesize DNA and undergo mitosis. Basal cell layer show ribosomes and element of rough endoplasmic reticulum indicative of protein synthesizing activity. Under electron microscope, these cells show in cytoplasm the element as rough endoplasmic reticulum and ribosome, which means the cells is produce protein. Also, these cells include two types of cells, either serrated or non-serrated cells. Serrated, heavily packed with a tonofilament, which are adaptation for attachment. And non-serrated or stem cells, these cells are slowly dividing cells, which serves to protect genetic information of the tissue. So we have in the basal cell layer two types of population of cells, which are either serrated, which heavily packed to each other by desmosome, and non-serrated, which is have a mitotic division, which are called stem cells. The second cell layer adjacent to the basal cell layer is Stratum Spinosum, or called Brickle cell layer. It is a layer of relatively large, irregular polyhedral cells, show first sign of maturation. A nuclei stay less intense. The intercellular spaces of the Brickle layer are large and distended with more prominent desmosome. So this is the cells of the Brickle cell layer or Stratum Spinosum. It's large polyhedral cells and attached to each other by desmosome, and there is intercellular spaces between these cells. And this is the main cell layer in the oral epithelium. The third cell layer in the keratinized oral epithelium is Stratum granulosum, or granular cell layer. This is few cell layer, about 2 to 3 cell layer, flat cells, and wider nuclei show sign of degeneration and pycnosis. Why we call it granulosum? Because the cytoplasms contain keratohyalin granules, which appear blue in hematoxin and eosin stain. Also, these cells contain oddland body, which is the keratinosomes, or membrane barrier cells. This oddland body present between granular cell layer and spinosum layer, and also between a granular and keratinized or the 4-cell layer. This membrane is as a barrier, and these cells also contain the 4-cell layer in keratinized epithelium is stratum corneum. This is the stratum corneum present on the surface above the stratum granulosum. This is stratum, and this is spinosum, and this is the basal cell layer, made up of keratinized squamous, which are larger and flatter than the granular cells. A nucleus and other organelles in the cytoplasm is disappear, so it's appear homogeneous, red or pink in hematoxylin and eosin stain. As we said before, keratinized epithelium either keratinized or orthokeratinized or parakeratinized. It depends on the keratinized layer. When there is no nucleus in the keratin, this is called orthokeratinized in this picture. And when the keratin is have a nucleus, this is called parakeratinized. epithelium. The parakeratinized, the superficial cells are dead but retain the nucleus, while the orthokeratinized, the nucleus are lost in the epithelium. All the other layer is like the orthokeratinized, which include basal cell layer, spinous cell layer, and maybe a granular cell layer is present or absent, and the nucleus is retained in the keratinized layer. The third type of oral epithelium is non-keratinized. Non-keratinized epithelium cells in the superficial layer do not have keratin filament in the cytoplasm. The surface cells also have a nuclei. The epithelium is associated with lining a mucosa of the oral cavity. Non-keratinized epithelium include also 4 cell layers, basal and prickle, the same as the keratinized layer. The difference in the granular and keratinized. Instead of a granular cell layer, there we have intermediate cell layer, and instead of the keratinized layer, we have the superficial cell layer in non-keratinized epithelium. This picture shows the 3 types of oral epithelium. A is the orthokeratinized, include basal cell layer, spinous or prickle cell layer, a granular cell layer, and keratinized layer. While in the parakeratinized, also we have basal cell layer and spinous cell layer or a prickle, and the granular may be present or absent, and the keratin with a nuclei. While in the C, we have a non-keratinized stratified squamous epithelium, which include 4 cell layer, also basal and prickle or Stratum Spinosum, and there we have intermediate cell layer instead of granular layer, and superficial layer instead of keratinized layer. This picture shows the turnover, show the cell layer in the keratinized epithelium. This is the basal cell layer, which is a cuboidal cell layer, and this is the prickle cell layer, which is polyhedral, and this is the granular cell layer, which have keratohyalin granules, and this is the surface layer, which is stratum corneum, which with pycnotic nuclei, and this arrow represents the turnover, which the cells, the new cells come from the basal and suprabasal cell layer, which is called stratum germinativum, to compensate the desquamation present here in the we have non-keratinocyte cells in the oral epithelium, which include 4 cell types and represent 10% of the cells in the oral epithelium, as we said before. These cells include melanocyte, Merkel cell, Langerhans, and lymphocyte. Melanocyte cells is dendritic cells present in the basal cell layer of the oral epithelium. Its embryonic origin from neural crest cells. These cells store melanin in the form of melanosomes, which elaborate melanin pigmentation responsible for pigmentation of the oral mucous membrane. Merkel cells is non-dendritic cells present also in the basal cell layer. It originates also from the neural crest cells and act as tactile sensory cells. Third, non-keratinocyte cells is Langerhans cells, which is also dendritic cells present in suprabasal layer. Its origin from the bone marrow. It involves an immune response. And the 4 cell non-keratinocyte cells is lymphocyte. It originates from hematopoietic stem cells and present in any layer of the oral epithelium, and it is associated with inflammation in the oral cavity. This is the picture show the drawing Picture of the cell present in the oral epithelium, which is non-keratinocyte cells. This is the Merkel cells, and this is the melanocyte cells, and this is Langerhans cells. Merkel's and melanocyte present in the basal cell layer, and Langerhans present in the suprabasal cell layer in stratum spinosum or brachial cell layer, and the inflammatory cells are present in the all cell layer of the oral epithelium. The second part of the oral mucosa is the lamina propria, which is connective tissue. It's composed of two layers adjacent to the oral epithelium called papillary layer, which is associated with epithelial ridges, thin, loosely arranged fiber, many capillary loops present inside. This is the papillary projection, and this is the epithelial ridges. The second part of the lamina propria is the reticular layer, which is thicker bundle of fibers that lies in parallel. Lamina propria also contain various cells, blood vessels, nerve and fibers, collagen and elastic fibers embedded in amorphous ground substance. The cells present in lamina propria include the main type of cells is the fibroblasts, histiocyte, macrophage, mast cells, polymorphonuclear leukocyte, lymphocyte, plasma cells, and endothelial cells, which surround the blood vessels. The third type may be present or absent, which is submucosa. This is the submucosa, which is also connective tissue. High concentration of blood vessels and nerve in the submucosa, site of minor salivary gland. This submucosa may be contain a minor salivary gland or fatty tissue. In the oral mucosa of the cheek, lip, and part of the heart palate, submucosa is made up of adipose tissue. In regions such as gingiva and part of the heart palate, the submucosa is not present. The oral mucosa attached firmly or directly to the periosteum of underlying bone by the mucoperiosteum, like in this picture. There is no submucosa, so the lamina propria is firmly attached to the periosteum of the bone. While here, there is a submucosa present in the types of lining mucosa. Effect of aging on the oral mucosa: epithelial thinning, decrease in keratinization, less prominent ready peaks, decreased cellular proliferation, also loss of submucosal elastin and fat, increased fibrotic connective tissue with degeneration, alteration in the collagen. General features of oral mucosa: first, separated from the skin by vermilion zone of the upper and lower lip, which is more deeply colored than the rest of the oral mucosa. So the vermilion zone is present in dark color than the adjacent oral mucosa. Second, factor affecting color of the oral mucosa is concentration and state of dilatation of blood vessels in the underlying lamina propria, thickness of the epithelium, degree of keratinization, and amount of melanin pigmentation. All these are affect the color of the oral mucosa. Clinically, color of oral mucosa is very important. For example, inflamed oral tissue appear red rather than the normal pale pink color. So when the gingiva is become red and edematous, this means there is a gingivitis, while when the color is pale pink, this means is normal. How the oral mucosa is differ from the skin? By color, moisture surface. The oral mucosa is moisture because it contains a minor salivary gland. Third, absence of adnexal skin structure such as hair follicle, sweat gland, and sebaceous gland. Exception in Fordyce disease, when sebaceous gland present in the oral cavity, in the upper lip and buccal mucosa and alveolar mucosa. Fourth, presence of minor salivary gland in oral mucosa. 5. Texture of the surface. Oral mucosa is smoother than the skin, in a few exceptions in the dorsal surface of the tongue due to presence of the papillae, and in the hard palate due to presence of rugae and stippling in the gingiva. Firmness. The oral mucosa varying in its firmness. For example, buccal mucosa and lip are loose and pliable because it contains a layer of submucosa, whereas in the gingiva and hard palate, the firmness is critical clinically. While during giving injection of anesthesia, because the gingiva and hard palate does not contain submucosa, so it's firmly attached to the. This picture shows the difference between the skin and the oral mucosa. This is the epithelial of the skin, which is thin, the epidermis of the skin. And this is the epithelium of the oral mucosa. And this is the adnexal structure, is hair follicle and sebaceous gland and sweat gland. While here there is no adnexal structure, but in the submucosa we have minor salivary gland, and this is the lamina propria, and this is the muscles. That's all for this lecture. Thank you for listening, and goodbye.